Should birth controls be free and easily available? Numerous females around the globe utilize some sort of prophylactic, otherwise called anti-conception medication. The CDC expressed that contraceptives are utilized by around one-third of females in the United States today. Be that as it may, a few ladies or youngsters are not lucky enough with the assets to acquire them, or they are not effectively available to them. These bothers have a high pregnancy hazard, which invalidates the sole point of conception prevention. They additionally lead to conceivable lawful issues and confusions with well-being. Over the long haul, and laws turns out to be more harsh, anti-conception medications ought to be accommodated, ladies, and at minimal effort, just as effectively available. I will first persuade you that by not having free and easily available birth controls can lead to an elevated pregnancy risk, then potential legal disputes, and lastly, health difficulties. In the prior year, there was a ton of conversation about counter embryo expulsion laws. In 2 or 3 states, untimely birth laws give no exemption to women who get attacked or get pregnant by interbreeding. One untimely birth law from the area of Georgia prohibits hatching evacuation after a fetal heartbeat has been recognized. Women may need to finish an untimely birth for a couple of reasons. For instance, not having the alternative to consider a youth, unconstrained pregnancy, or whether or not she is an overcomer of attack. However, getting a baby evacuation is illegal, and the pregnant women would run into legal issues if an untimely birth is furthermore executed. Next, I will discuss the health complications of not being able to maintain birth control if a woman is unable to obtain them. On the off chance that a lady cannot gain birth power after already taking them, a few unexpected problems may happen. On the off chance that a lady quits taking conception prevention, results are at a higher danger. A couple of the momentary impacts are despondency and additionally nervousness. PMS, which causes skin breakout and food longings, cerebral pains, or discharging prior or later in the cycle than expected. These side effects can happen a long time after the lady falls from the conception prevention, which is the point at which the body's normal hormones kick back in. Next, I will begin by talking about how the discrepancy of birth controls can trigger a high pregnancy risk. In the public field today, various women are utilized against origination medicine to decrease the risk of getting pregnant. Contraception, as demonstrated by the renowned prosperity website WebMD, is any system used to hinder pregnancy. Hostile to origination drugs, in any case called contraceptives, can go from condoms against origination medicine pills, tubal ligation IUDs, hostile to origination prescription shots, and other different enemy of origination prescription procedures. A couple of techniques like condoms can be found in drugstores or convenience stores, inferring that they are comprehensively open. Various systems like medication pills require a master or clinical. Lastly, I will discuss the health complications of not being able to maintain birth control if a woman is unable to obtain them. In case a woman cannot pick up birth power after previously taking them, a couple of sudden issues may occur. In case a woman stops taking origination avoidance, results are at high risk. A few of the transitory effects are discouragement and furthermore apprehensive PMS, which causes the skin breakout and food longings, cerebral agonies, or releasing earlier or later in the cycle. These results can happen quite a while after the woman tumbles from origination anticipation, which is where the body's ordinary hormones kick back in. The use of contraception will continue growing anyway, with them being more perplexing to get. Various women will be at a weight. Without them being free and viably open, the terrible, especially ladies who cannot get the origination counteraction, ought to go up against a higher peril for pregnancy, possible authentic issues, and surprising issues. These contraceptives should be given at, for all intents and zero cost, and they should be successfully open to all women who require them.